Hello folks, how are you doing? This is Don Kelly here. Happy Wednesday to you all. Just a quick vlog here. I'm going to talk about some leg pain and especially leg pain from the knee down. Okay, so I'll be 3 or 4 minutes just talking about some different conditions that you can get in your lower leg and how you can help prevent them from happening. Okay, first of all, we'll talk about muscle cramps. Okay, and muscle cramp is basically where it's very common at night time. You know, you might wake at night time and the muscle goes into a spasm. It really tightens up and it can be very painful. It's an intense pain. You can't move your foot, you can't straighten your leg, and there's an immense tightness there, and that can take a few minutes for that to settle down. Okay, but it's most common at night time, and it happens in the calf. So it can be a sign of muscle dehydration, okay, and maybe lack of activity. So to help prevent it, drink plenty water, stay hydrated, and that can help prevent muscle cramps, especially at night time, or especially if you're sitting down for long periods of time. The cramps can get really bad. So with cramps, the secret is if you get them, stay moving, do calf stretches, and do some stretching maybe before you go to bed as well. Okay, and drink plenty water. Uh, Another lower leg condition that's very common is shin splints. Now, shin splints is a pain where you will get down in the front of your leg by your shin there, the bony part, and just on the outside of that, that can get very sore. So what you do with that is that can be caused by you'll see a lot of people, runners get it, okay? So running and jumping and sports people can tend to get shin splints, okay? You'll find a lot of people who do get shin splints wear bad runners or wear bad shoes with very little support in them. They tend to have flat feet, low arches, and they tend to walk with their feet, kind of pointed outwards when they walk, okay? So they could tend to have a high arch as well, and those kind of conditions can cause shin splints. So what can help relieve shin splints is you wear good fitting shoes, wear good runners with good arch support. You can do some ice massage on it if you get pain after activity. You can use a rolling pin or a tin of beans or something like that. Just roll it up and down the leg where you have the pain, a little bit of self-massage, and that can help with shin splints. But generally what's really good for reducing and stopping shin splints are a good quality, high quality, specially made orthotic that can be very beneficial for anyone who's suffering from shin splints. Okay. Another lower leg condition is Achilles tendonitis, and this is a tricky one. It can be slow to heal because it's the tendon, and as the tendon doesn't have the same level of blood supply as a muscle, it can be that bit slower to heal. But it's generally inflammation of the tendon just as the calf attaches to the heel, and people will find that it can be very sore to touch, and climbing stairs and climbing ladders can aggravate it, or trying to run or trying to jump again will cause pain or discomfort in that. It's commonly seen in runners, and it's commonly seen in people who climb ladders or do a lot of climbing for a living. Okay, so painters, people who climb ladders get it a lot, runners. And again, reason for it, you can overuse, if you're doing a lot of running, ill-fitting shoes, stuff like that can bring on Achilles tendonitis, and it can be very sore, and it can be very difficult to treat and slow to heal. So my advice is, if it's causing pain when you're being active with it, you need to get it checked out and just rest from what you're doing. If in other words, if you're a runner and you're getting Achilles tendonitis, don't keep running on it, aggravating it. Give it some time to rest and heal. Okay, and that can help as well. But stretching out the Achilles tendon can help, but also strengthening it can help as well. So do some strengthening exercises on the Achilles tendon there. That can help. maybe standing at the edge of the stairs with your ball of foot on the stairs and just going up on your tippy toes and coming down, up and down, and get a little strengthening exercise on that. That can help with Achilles tendonitis. As I said before, a lot of the science now is saying that strengthening exercises is more beneficial than stretching. Not all the stretching is good, but do some strengthening exercises there as well. Okay, other issues that can happen in the lower leg is broken. You can get a leg break or you can get sprains. Okay, sprains tend to happen around the ankle joint, and the break will tend to happen on the tibia or fibula. Okay, most commonly the fibula, but it can happen in the tibia. If you think your leg is broken or you're after breaking a leg, you will not be able to weight bear on it. There won't be a hope in heaven that you can weight bear on that. And if that's the case, you need to go to the hospital or go see your doctor straight away and get that checked out. Okay, an ankle, again, if it's broken, if you've broken a bone in the foot or in the ankle joint, you will not be able to weight bear on it. Totally, 100%, you will not be able to do that. So again, you go to the hospital, all right? Go get that checked out. If it's a sprain on the ankle or around the lower leg, it will generally, if it's a bad one, it will bruise a lot, okay? And again, you'll be able to weight bear in it, but it'll be very uncomfortable, all right? But a general sign that you've tore ligaments or done a serious sprain around the ankle joint, it will bruise up a lot, okay? So use the RICE method: rest, ice, heat, and some compression. That's a good first aid method, and use that to alleviate any pain. Okay, so that's some tips there on how to alleviate lower leg pain. Remember, if the pain doesn't go away, you got to go and get it medically checked. Always get these things medically checked out, especially if the pain is constant. Okay, if you have pain in your calf muscle and it's a constant pain with no relief from anything, you got to go and get that checked out straight away. It could be danger, it could be a clot. Okay, so any constant pain in the calf that is not alleviating, that is not going away with anything, you got to go and get that medically checked as soon as possible. Don't leave anything like that linger about. Okay, so that's my little vlog on leg pain, lads. I hope it helps. Any queries, please message me, mail me. I will always get back to you. And everyone have a great Wednesday, and we will talk to you all soon. Have a great weekend, or have a great Wednesday, I should say. God bless, lads. Talk to you all soon. Bye-bye.